The first thing I want to indicate is that the department, after working with general practices, has now approved over 4,600 general practices to participate in the rollout. We had initially hoped that we might be able to get 1,000 practices, and that was lifted to over 2,000, and I'd subsequently given guidance to 3,000. But with the high uptake from these general practices and the fact that they have been assessed, they have been approved, and they are now being notified, over 4,600 general practices will be participating in the rollout. They will come on in phases, and those phases will now be worked through with the general practices as we begin in phase 1B and during the course of the second phase, phase 2 of the rollout. And so I do want to thank Australia's doctors, Australia's general practices for stepping up to the plate in numbers greater than we had ever hoped, and that's, I think, a really important sign. The second thing is that with regards to the rollout, as we've been monitoring around the country, the advice that we have and that the Chief Medical Officer has had from his counterparts in other states and through our own outreach is that so far there have been no adverse reactions other than ordinarily expected things such as sore shoulders from the administration of the vaccines. But the Vaccine Operations Centre continues to monitor and will continue to monitor throughout the rollout. This is consistent with international guidance and practice, and Paul will give you more of an update on the international outcomes as well. The third thing is to acknowledge that there has been one case following all the safeguards we have in place of what has been defined as an adverse administration. Basically, a doctor gave an incorrect dose to 2 patients yesterday. I think it's very important that we're up front. The safeguards that were put in place immediately kicked into action. A nurse on the scene identified the fact that a higher than the prescribed amount of the dose was given to 2 patients, an 88-year-old male and 94-year-old female, in a Queensland aged care facility, in particular Holy Spirit Castledine in Queensland. I think it's important that we just provide the information as we have it. The important thing is that the advice that we have, and I've spoken with the Queensland Health Minister this morning, Paul has been working with his counterpart in Queensland, is that both patients are being monitored and both patients are showing no signs at all of an adverse reaction. But it is a reminder of the importance of the safeguards. A number of things have occurred. Firstly, the nurse on the scene stepped in, and I want to thank her for her strength of character and her professionalism. Secondly, the contractor has stood down the doctor in question from the program. Thirdly, the monitoring of the patients, which is the most important thing, has been ongoing, a partnership between the Commonwealth, the facility and Queensland Health, and I want to thank Queensland Health and in particular the Queensland Chief Health Officer as well as the Queensland Minister Yvette Darth. She and I were in contact late last night and early again this morning. And in addition to that, the Chief Medical Officer is engaged in the early incident work, and the Deputy Chief Medical Officer of Australia, Professor Paul Kidd, who's an esteemed general practitioner, will review the events, make any recommendations, but every participant can only participate in providing vaccinations so long as they have had the training, and so we will examine what were the circumstances. That will be ongoing, and we'll provide public guidance. But the most important thing is that we engage in the transparency. When we know, we provide that information, and significantly that the patients themselves are showing at this point, on the latest advice that I have 5 minutes before joining you, absolutely no adverse reaction. It is in line with the fact that significantly higher doses than had finally been chosen were used as parts of some of the early clinical trials around the world. So the rollout continues. There will be cases, there will be challenges. This has happened in other jurisdictions overseas. and I think Professor Kelly will fill you in on that.